is taking this program today is with Dr. Adio, and he will be talking about cataract, and the theme is seeing the world through new eyes. Thank you, Dr. Adio. You may carry on.
Thank you, Mr. Wimbo. Welcome everybody to our question and answer session. I'm Dr. Adio. The topic I'll be presenting on is seeing the world through new eyes. So the first question I want to answer is, what is a cataract? Cataract is a clouding of the lens in the eye that affects the vision. Most cataracts are related to aging and are therefore very common in older people. A cataract can occur in either of both eyes. It cannot spread from one eye to the other. And globally, at least 2.2 billion people have a near or distant visual impairment. At least 1 billion or almost half of these cases. The commonest condition causing distant visual impairment or blindness is cataracts, which is 94 million. According to the Nigerian National Blindness Survey, cataract is the most common cause of severe visual impairment and blindness, being responsible for 5.3% of severe visual impairment and for 3% of blindness. Now, what is the lens? The lens is a clear part of the eye that helps focus light or an image on the retina. The retina is the light-sensitive tissue at the back of the eye. In a normal eye, light passes through the transparent lens to the retina. Once it reaches the retina, light is changed to nerve signals and sent to the brain. So therefore, the lens must be very clear for the retina to receive a sharp image.
Sorry, Dr. Adio, your slides are not changing, or you are not changing them yet?
How about now? Is it changing?
No, it's still on the first page. Okay, it has changed now. It has changed now.
Is it changing now?
Yes, it has changed now. It's on what is cataract.
Okay. Right now, on the second slide, what is the lens?
Oh, it hasn't changed to that. It's on what is cataract.
Alright, let me share it.
Okay, please share your screen.
Alright, I've reshared it. Can you see the screen now?
No. Yes. It's on what is the lens.
Yes, and it's moving, right?
Have you changed another slide? Yes, it's moving now. Yes, it's moving now.
Okay, so I'm going back to what is the lens.
Okay.
And I was saying the lens is clouding from a cataract. The image you see will be blurred. The next slide, this is a picture of a patient with a cataract in one eye and the other eye without the cataract. To the right of the screen, you see that there is a patient in the left eye that has a whitish opacity there, right? And that's the cataract. In the other eye, which is to the left of your screen, you see that's a normal eye, or an eye without the cataract face. The next slide, what causes cataract? So the lens is mostly made up of water and protein, and the protein is arranged in a precise way that keeps the lens clear and lets light pass through it. But as we age, some of this protein they clump together and start to cloud a small area of the lens. This is a cataract. Over time, the cataract may grow larger and cloud more of the lens, making it harder to see. Smoking and diabetes contribute to the development of cataracts. Or it may be that the protein in the lens just changes and the wear and tear it takes over the years. Who is at risk for cataract? So, there are a couple of risk factors. Number one, increasing age. Like I mentioned initially, it's more common in older people. Diabetes, patients with diabetes, excessive exposure to sunlight and ultraviolet radiation, smoking, high blood pressure, previous eye injury or trauma or previous inflammation, previous eye surgery, could be any kind of surgery, except another cataract surgery, prolonged use of steroid medications or corticosteroid medications, drinking excessive amounts of alcohol, nutritional deficiency. Some cataracts are congenital, meaning that they occur in babies and they are born with it, and this could be caused by a genetic cause or part of a systemic symptom of disease. Meaning that in children, cataracts can also occur, not just in adults. So what are the symptoms of a cataract? The most common symptoms of cataracts are, number one, cloudy or blurry vision. The colors will seem faded, will be glare, meaning that the headlights, lamps, or sunlight may appear too bright. Sometimes you see a halo appearing in all the lights. Maybe poor night vision and double vision or multiple images appear in one eye. Usually this symptom clears as the cataract gets larger. And sometimes you might see that you have frequent prescription changes in your eyeglasses, which means sometimes as frequent as 3 months, 6 months. Usually it should be around 2 years where your prescription is changing. So if it's too frequent, then you should definitely get your eye checked. So this is just something to show how a patient with cataracts will see the world. So on the left is a normal vision, and on the right is the patient with blurry vision secondary to cataracts, which is due to cataracts. How is a cataract detected? Cataract is detected through a comprehensive eye exam, which includes, number one, the visual acuity test. That's the eye chart test. It measures out where you see at various distances. It will give you a chart to read at a distance and also one to read at near. The dilated eye exam, drops are placed in your eyes at the clinic to widen or dilate the pupils. Your eye care professional uses a special magnifying lens to examine your retinal optic nerve for signs of damage or other eye problems. And usually after the exam, your close-up vision, near vision will remain blurred for a few hours. Now, how is a cataract treated? Usually, the symptoms of early cataracts, very early cataracts, may be improved with new sunglasses, with new eyeglasses, and brighter lighting, anti-glare sunglasses. But if these measures do not help, surgery is the only effective treatment. A cataract needs to be removed when vision loss interferes with your everyday activities such as driving, reading, or watching television. Sometimes a cataract should be removed even if it does not cause problems with vision. For example, if it's preventing your ophthalmologist from examining or treating another eye problem that you would have, such as an age-related macular degeneration like diabetic retinopathy. Cataract surgery is one of the safest and most effective types of surgery in the world. In about 90% of cases, patients who have cataract surgery have better vision afterwards. As with any surgery, cataract surgery poses risks such as infection and bleeding. Before the cataract surgery, your doctor may ask you to temporarily stop taking certain medications that increase the risk of bleeding during surgery. And after the surgery, you must keep your eye clean, wash your hands before touching your eye, use the prescribed medication to help minimize the risk of infection, because serious infection can result in loss of vision. Now, what happens before the surgery? A week or two before the surgery, your doctor will do some tests. These tests may include measuring the curve of your cornea, size and shape of your eye, and this information helps the doctor to choose the right type of intraocular lens. And you may also be asked not to eat or drink anything 12 hours before your surgery. What happens during the surgery? At the hospital or eye clinic, drops will be put into your eye to dilate the pupil. The area around your eye will be washed and cleaned. The operation usually lasts less than 1 hour and is almost painless. It involves removing the crowded lens from the eye through a tiny incision and replacing it with an intraocular lens. Many people choose to stay awake during the surgery. Others need to be put to sleep for a short period of time during the surgery. If you are awake, you will have an anesthetic to numb your eye so you won't feel any pain. After the operation, an eye pad will be placed over your eye. What happens after the surgery? Itching and mild discomfort are normal after cataract surgery, and also some fluid discharge is also common. Your eye may be sensitive to light and touch. After 1 or 2 days, moderate discomfort is okay. For a few weeks after surgery, your doctor will prescribe eye drops to help heal and decrease the risk of infection. You will need to wear an eye shield or eyeglasses to help protect your eye. You also need to avoid rubbing or pressing your eye. When you are home, try not to bend from your wrists. Pick up objects. Do not lift any heavy objects. You can walk, climb stairs, and do light household chores. In most cases, healing will be complete within 8 weeks. Your doctor will also schedule exams for you to come to the clinic so you can check on your progress. Can problems develop after surgery? So problems after surgery are rare, but they can occur. These problems can include infection, bleeding, inflammation, which can show up as pain, redness, swelling, loss of vision, double vision, and high or low eye pressure. But with prompt medical attention, these problems can usually be treated successfully. Sometimes the eye tissue that encloses the eye of the intraocular lens becomes cloudy and may blur your vision. This condition is called an after cataracts. It can develop months or years after cataract surgery, and it can be treated with a laser. This procedure is called a YAG laser capsulotomy, and it is painless and rarely results in any after effects. So when will your vision be normal again? You can return quickly to many everyday activities. Your vision may still be blurry, but the healing eye needs time to adjust. But usually, you can return to your everyday activities. And healing eye needs time to adjust so it can focus properly in the other eye, especially the other eye of the cataracts. Also, when the eye heals, you most likely need new glasses or contact lenses. In conclusion, cataract is a common cause of visual decline, but it can be completely treated through cataract surgery so you can see the world through new eyes. Thank you very much.
Dr. Adio, thank you so much. Fortunately, we have some of our audience that are just joining us. Would you mind giving us a quick recap of everything?
Okay.
Then could you put your slides on presentation mode?
All right. Let me know. Is it moving?
Yes, it's on this image.
There's a slide share now. It's moving, right? Can you see the image moving?
It's on the cataract, that image of the baby, the child with the cataract, but it hasn't changed.
Yeah, that's why I removed it from the slide share.
Okay, there's no problem.
I'm using the slide.
So that's fine. Please carry on. As you did it before, it's moving now. Okay.
Should I just start from the beginning again, or
yes, from beginning, just run through it. A quick recap.
Okay. All right. Okay, so the topic is seeing the world through new eyes, and I define the cataract, which is a clouding of the lens in the eye that affects vision. It can occur in either or both eyes. It cannot spread from one eye to the other. Globally, cataracts is the commonest condition causing distance and vision impairment or blindness. It affects 94 million people out of the 1 billion people that have distance vision impairments. And in Nigeria, cataract is the commonest cause of severe vision impairment, and it's only 45.3% of severe vision impairment and 43% of blindness. I also talked about the lens, which is a clear part of the eye that helps to focus light on the retina. And the retina usually is what sends signals or the image that you are seeing to the brain so it can be interpreted. Therefore, the lens must be very clear so that each image can fall on the retina. If the lens is cloudy from the cataract, the image you see will be blurred. And this is a picture. On the right side of the screen, you see the eye there with the cataract. On the other side of the screen, the eye is without the cataract. What causes cataracts? The lens is made up of water and protein, and these proteins are arranged in a precise way so that the lens is clear and light can pass through it. As we age, some of the protein may clump together and start to cloud a small area of the lens, and this is how a cataract forms. Over time, it can grow larger and cloud more of the lens, making it harder to see. Who is at risk for a cataract? Basically, what can cause cataracts? Number one, increasing age is the most common. Diabetes, excessive exposure to sunlight, ultraviolet radiation, smoking, high blood pressure, previous eye injury or inflammation, previous eye surgery, any kind of eye surgery, except of course previous cataract surgery, prolonged use of corticosteroid medication, drinking excessive amounts of alcohol, nutritional deficiency. Some cataracts are congenital, meaning that the baby is born with cataracts, and this can have either a genetic cause associated with a systemic syndrome or a disease. The most common symptoms of cataracts are cloudy or blurry vision. The colors may seem faded or reduced contrast sensitivity. Patient can also have glare, meaning that headlights, lamps, sunlight may appear too bright. Sometimes you may see a halo around lights. And also have poor night vision, double vision, or multiple images in one eye. Also, frequent prescription changes in your eyeglasses or contact lenses is a symptom of cataract. But all these symptoms are not specific to cataract. They can also be seen sometimes in other eye conditions, but when you see your eye doctor, when you have a diagnosis. So this image shows on the left part of the screen a patient seeing two children. The patient has normal vision in that eye. On the right side of the screen, you see that is how the patient with cataract sees the world. How is a cataract detected? Cataract is detected through a comprehensive eye exam. This includes a visual acuity test. You go to the eye clinic and they give you a chart to read, one at distance, another one at near. Also, a dilated eye exam. Drops are placed in your eyes to widen your dilated pupil, and your eye doctor examines your eye, your retina, optic nerve for signs of damage and other eye problems. So after this exam, your close-up vision may be blurred for a few hours. How is a cataract treated? So the symptoms of early cataract may be improved with new eyeglasses, like I mentioned before, the frequent changing of glasses, brighter lighting, or anti-glare sunglasses. But if these measures do not help, surgery is the only effective treatment. A cataract needs to be removed when vision loss interferes with everyday activities, such as driving, reading, or watching television, or using your mobile phone. Sometimes a cataract should be removed even if it does not cause problems with your vision. For example, if it is preventing the examination or treatment of another eye problem that you may have, such as an age with macular degeneration or a diabetic retinopathy. Cataract surgery is one of the safest and most effective types of surgery in the world. In about 90% of cases, people who have cataract surgery have better vision afterwards. As with any surgery, cataract surgery poses risks such as infection and bleeding. So before the cataract surgery, the doctor may ask you to temporarily stop taking certain medications that increase the risk of bleeding during surgery. And after surgery, you must keep your eye clean, wash your hands before touching your eye, use the prescribed medications to help minimize the risk of infection, but serious infection can result in loss of vision. What happens before the surgery? A week or two before the surgery, your doctor will do some tests, which include measuring the curve of the cornea and the size and shape of your eye. This information helps your doctor to choose the right type of intraocular lens for your eye. You also may be asked not to eat or drink anything 12 hours before your surgery. What happens during surgery? At the hospital or eye clinic, drops will be put into your eye to dilate the pupil. The area around your eye is washed and cleaned. The operation usually lasts less than 1 hour and is almost painless. It involves removing the cloud lens from the eye through a tiny incision and replacing it with intraocular lens. Many people choose to stay awake during surgery. Others may need to be put to sleep for a short time. If you are awake, you will have an anesthetic to numb your eye, so there will be no pain. After the operation, an eye pad will be placed over your eye. So what happens after the surgery? You may experience itching and mild discomforts, which are normal after cataract surgery. Some fluid discharges also come up. Your eye may be sensitive to light and touch. After 1 or 2 days, moderate discomfort should disappear. For a few weeks after surgery, your doctor will prescribe eye drops to help healing and decrease the risk of infection. You will need to wear an eye shield or eyeglasses to help protect your eye. Avoid rubbing or pressing on your eye. When you are at home, try not to bend from the waist to pick objects on the floor. Do not lift any heavy objects, but you can walk, you can climb stairs, and do light household chores. In most cases, healing will be complete within 8 weeks, and your doctor will schedule exams to check on your progress. Can problems develop after surgery? So problems after surgery are rare, but they can occur. These problems include infection, bleeding, inflammation, which show up as pain, redness, or swelling, loss of vision, double vision, high or low eye pressure. But with prompt medical attention, these problems usually can be treated successfully. Sometimes the eye tissue that encloses the intraocular lens becomes cloudy and may blur your vision. This condition is called an after cataract. An after cataract can develop months or years after cataract surgery and can be treated with a laser. The doctor uses a laser to make a tiny hole in the eye tissue behind the lens to let light pass through so it can reach the retina. And this procedure is called a yard laser capsulotomy. It is painless and rarely results in any side effects or complications. When will my eye vision be normal again? So you can return quickly to many everyday activities. Your vision may be blurry because the healing eye needs time to adjust so that you can focus properly with the other eye, especially if the other eye has a cataract. Also, when your eye heals, you will most likely need new glasses or contact lenses. In conclusion, cataract is a common cause of visual decline, but it can be completely treated through cataract surgery so you can see the world through new eyes. Thank you.
So thank you everyone. Please, thank you. Do we have any questions? Dr. Adio is online to answer our questions. This is our cataract week, and the theme is looking through the world through new eyes. Okay, so there's a question online. Is surgery the only solution to treat cataract? Can drugs be used to treat cataract? Dr. Adio?
Right, so surgery is the only option to treat a cataract. Drugs will not be able to do anything for the cataract because the clouding lens that is there, it has to be removed and an intraocular lens placed in. So drugs will not be able to do that. Surgery is the only effective option.
Irrespective of the stage of irrespective of the stage.
Yeah. Dr. Adio, they say what about irrespective of the stage of the cancer of the cataract?
I mentioned initially in a very mild or early cataract, your vision can be improved by prescription of eyeglasses, so it can be bypassed like I mentioned. But you will notice that the prescription will be frequently changed, which is one of the symptoms of cataract. So it might be something like every 6 months you have to be changing glasses because the cataract is getting more and more mature. So that is why the only effective treatment is a surgery.
Sorry, what every
and to get a point where we sorry?
So question. Yeah. Was every client that passed through surgery, was they use glasses after the surgery? After surgery, is it compelled for every client to use eyeglasses after the cataract surgery?
Dr. Did you get that?
No, I didn't get you.
She said, is it compulsory for everybody to use glasses after surgery? Is it every patient that uses glasses after surgery? Hello, Dr. Adio.
Not every patient is cataract. I get the question. So not every patient uses glasses after surgery. There are some special lenses that can be placed into the eye that can bypass the need for the use of glasses, especially reading glasses. So it depends on the kind of intraocular lens that is placed in the eye, and also the discussion with your doctor, and also the patient's needs. Right? Sometimes you may think that there is a special intraocular lens placed in the eye that helps to bypass the need for reading glasses, right? And sometimes it might be that the intermediate vision also can be corrected after that. So there are different kinds of intraocular lenses that can be placed into the eye to meet the various needs of the patient after cataract surgery, right? So sometimes it might be glass, sometimes it might not. So it really depends on your examination by the ophthalmologist, and also the discussion on your needs, visual needs, following the cataract surgery.
Are there any other questions? Yes, sir.
My question is.
I hope that answered the question.
So, who can answer the question?
Yes, thank you.
Okay. Yes, sir.
My question is that this thing happened to me. When I had my first glaucoma surgery, at the time my vision began to come down.
Sorry, I cannot hear you. Pick away and say, I'm very sorry.
He said it happened to him after his first glaucoma surgery.
Yeah, my vision at the left eye began to drop.
His vision on his left eye began to drop.
So
Okay.
when they diagnosed, they said they saw cataract there.
When they diagnosed, they said he had cataract.
So and I went for the cataract surgery.
You went for cataract surgery.
After the surgery, there was a kind of negative reaction. So they said they saw a growth. I would go back. They would give me medication. The thing would come down. After some time, the thing would be back there. Then at the time, it came up with this cataract nature thing. The cornea became white.
Said he reacted negative to the surgery. They found a growth. Then after a while, his cornea became white.
Yeah.
Okay.
Okay.
So what will be happening in that way? And that is why I'm here too. I'm trying to take care of the cornea.
So he's trying to know what. Okay, go on.
What's your question, sir? Your question, sir.
What's the question?
I said, what would be happening in that case? And
What could be happening?
yeah.
Okay, what would be happening in that case? Okay. So, like I mentioned in my discussion, that cataract is also caused by other eye surgeries. Can be caused by other eye surgeries, not all the time. So it can be caused by a patient undergoing glaucoma eye surgery also, right? So that is why you have the cataract. Now, for the whitening of the cornea, really, sometimes use of some eye drops, use of following some surgeries, not just cataract surgery, also patients with glaucoma, those patients are more likely to have whitening of their cornea. So it really is multifactorial, or it can be caused by different factors, right? So that's most likely the event that led to that. But our topic for today is cataract. So in terms of the cause of the cataract, yes, the cataract that you developed could have been caused by the other combination glaucoma, or the glaucoma surgery itself. Hello?
Yes, well, yeah. I didn't hear that question. That's your question. Yes.
Is it possible someone that has a cataract on the two eyes, after the surgery, is it possible for him to have a glaucoma again?
So if person has cataract on both eyes, he has had the surgery, and he still have glaucoma.
So one thing about the eye condition, cataract or glaucoma, they can coexist. So it is not only that it can occur afterwards. The patient could have had these conditions at the same time initially. First time he saw the doctor. But the thing about cataract is that because it is the way it is blocking your view also of the world, it's also blocking the view of the doctor from seeing the retina and the optic nerve, which is what tells us that there is glaucoma, right? So usually that is most times what happens. But also, like in my discussion, I mentioned that sometimes some complications of cataract surgery will be high pressure and low pressure. So if there is high pressure following the cataract surgery, then it can lead to glaucoma. But like I said, these complications are rare and can be treated with prompt medical attention.
Does that answer your question? Are there any other questions? I have a question. Yes, sir.
All right, so my question is regarding genetics. You mentioned something about someone being born with cataract, you know. And,
yes.
Yeah, so my question is, like some parents can have cataract, then because of that, is it a must the children will have cataract, or what's the statistics of the genetic, existence effect of this, cataract?
Okay. So the genetic condition I mentioned is called congenital cataract. So this genetics is the occurrence of cataracts in childhood, right? So if the parents, for instance, when they were a child, had cataract, or a baby had cataract, then it could have a genetic connotation for their child in the future developing a cataract, or because we've seen some conditions where 3 generations of the family having cataracts in their childhood. But that is different from developing cataracts as an adult. Okay? Developing cataracts as an adult is different and is due to all the other causes I mentioned, which is increasing age, diabetes, smoking, all those other conditions I mentioned. But genetics, it is when it occurs as a child, and then that's individual growth of, then the genetics also passes to that. The genes also pass to their child that could have it also as a baby. So that's the condition I'm talking about. I don't think that answers the question.
So that's one. So my question now is, as a parent, can you, if you have normal cataract when you are, does it mean your children will also have it at a certain age in their adulthood?
That is inheritance.
Then in addition, so that you can answer both together, what can person do so that to prevent the children from having?
Dr. Adio, do you get that?
Okay. I got it. So for the first question, I'm talking about the parents having adults cataracts and then preventing the child from having its adult cataracts also. Like I mentioned, the main cause of cataract is increasing age. So just the way that you as a parent grow older and eventually develop cataracts, your child eventually grows older, who develop cataracts at the increasing age. Doesn't mean they develop it at 30 or 40. It's not that because you have a cataract at 60, means that your child is going to have it at 30. No, it is like an aging process, right? And this is minus other factors like diabetes and trauma, other things that can cause cataracts. But then purely the most common cause, increasing age now, is something that is equal among all human beings, right? This is not genetics. This is all human beings. Eventually you grow older, and that's just the way you get gray hair. It's the same way that the cataract will occur, right? So that is the explanation behind that. So prevention of your child having cataract. I'm not sure if the question also ties into his own question. Is it adults with cataract trying to prevent, or which one? Or the child with cataract? For the second question, or is just a general?
Prevention the child, so that the child will not have, so that a child of the patient that has cataract, so that the child to.
How do you prevent it?
But you answer because of your answer. Yes, he has answered. I've forgotten the answer.
Doctor, I have another question. Sorry.
Okay, sorry. One more. So there's a question online. Before I'll come back to you, sir. It said, when the cataract results in blindness, is there any solution?
So usually, one of the ways that the cataract can result in blindness is the cataract leading to other conditions like a glaucoma or for instance, corneal opacity, widening of the cornea, like one of our patients talked about. So those can still be treated, but sometimes the glaucoma is irreversible. Glaucoma is irreversible usually, but blindness is not always just the patient seeing black, right? According to WHO, there's a certain standard of definition of blindness, and cataract is the most common reversible cause of blindness, like I mentioned. So meaning that it can be reversed through cataract surgery, right? So just because you say blind, it doesn't mean the patient is seeing black or not seeing anything at all, right? There's a certain definition we have of blindness, and cataract surgery can reverse that blindness. But you have to be evaluated by your ophthalmologist prior to that.
So, sir,
My point is diabetic cataract. Diabetic cataract and coronary cataract, someone who don't have insurance, is it the same thing?
diabetic cataract and normal cataract. Is it the same thing?
Sorry?
Diabetic cataract. And then and someone has normal cataract.
Is it the same thing?
Is it the same thing?
Well, the cause is different, but in general, the cataract is crowding on the limits, right? So they lead to the same thing. They still cause a cataract, and at the end of the day, you still have to remove the cloudy lens, like I mentioned, and put in the intraocular lens. So the cause is different, and there's some other things you have to check. For instance, the patient's blood sugar, make sure it's under control. All of the things that a doctor will want to check before the surgery, as opposed to the age-related cataract that is due to increasing age. You check those things, but they are not reliant on the diabetes. So the cause is different, but the effects is still both cause a cataract. I think that's an answer to your question.
Yeah. When the opacity is unilateral on one eye and the other one is partial, when is it likely the second one will be as matured for surgery?
Okay, so thanks for the question. You're saying after the first cataract surgery has been done, right?
Yeah.
So usually after the first cataract surgery has been done, we usually want to wait for about a month, right? Depending, but a month before we do, at least a month before we do the second cataract surgery, just to give the other eye time to heal and get used to everyday activities. But it depends, the surgery being done in the other eye depends on the maturity of that cataract. So your doctor might say, okay, we want to see every 2 months, every 3 months, depending on the maturity. If the cataract is not mature, we can say we want to see every 3 months because we expect the level of maturity of the cataract to be occurring every 24 months. Or it could be that the cataract is already mature to a certain stage that 1 month after your initial cataract surgery, you can go ahead with the second cataract surgery. So it really depends on what your doctor sees and examines when examining you. So, but that's usually the time frame, and usually depends on the maturity of the other eye.
Okay. May I know if there is any impairment when the other one is not done yet? Does it affect one side? Maybe your glasses, the glasses you are using before, you need to change it, or you still maintain using that same glasses. I mean the lens, since they are not of the same, they are not in the same grade.
Yeah, so it will take you much longer to get used to the vision, the new vision, or the new vision that you just acquired in one eye. Actually, if the other eye, as I mentioned as in the expression, it's something that will take a longer time to adapt. And it's just like having one eye that sees very well and the other eye is not seeing as clearly. It may give you a bit of double vision, right? It may give you a double vision, or just like, but it's not as if it's going to be blindness. You see in one eye, but your vision might be we see multiple images, double vision, stuff like that. So it's advisable that as soon as your doctor says you're ready for your cataract surgery, the other eye, you go ahead with it.
Thank you. Thank you.
Yeah, you're welcome. Any other questions?
Any other questions? Are there any other questions? If not, thank you. No other question? If not, thank you very much. What?
Just one last thing is that once also in general, just to suit the development of cataracts, is to use sunglasses, avoid exposure or reduce exposure to sunlight on the face, reduce smoking, reduce drinking. When you stop smoking, then stop smoking, reduce drinking, control your diabetes and other systemic risk factors. See your general doctor, the physicians, just to address any other systemic,
No other question? Thank you so much, everyone. Really appreciate you coming to our event. Have a lovely day. Thank you so much.